we've recently made to the overall format of the program due to COVID-19. Here's the roadmap for our time today. I'll start by introducing our fellowship team. I'll then provide an overview of the program, and we'll hear from Sarah Blossom, Director of Certification. Next, I'll provide information around how to apply and what that process will look like. And then, of course, we'll have plenty of time for questions. So on this slide, we have our fellowship team. And I have to say there are really many more faces and names that should be on this slide because this fellowship program really represents an organization-wide effort, and many hands have gone into the planning of this program, including teaching and mentoring. But the core team here includes Peter Mate, the fellowship senior sponsor, and also IHI's newly appointed president and CEO. For the 2021 class, we have Kate Hilton joining us as core faculty, myself, Allison Perry, Sarah Blossom, Director of Certification, and Elena Oregulo, Senior Event Assistant. The fellowship program is a fantastic representation of the merger between the organizations IHI and the National Patient Safety Foundation. In 2017, our two organizations merged. Both had fellowship programs that looked very different from one another, and last year we undertook a major redesign process to bring the two models together. And the result is the program that is currently underway. This class, the current class, was well on their way through the program, but unfortunately, due to COVID, they were not able to graduate as planned at our Patient Safety Congress in May. That, coupled with the disruption in all of their lives, for some quite significant. We made the decision to extend the program through December 2020 to ensure that the content and experience for this current fellowship cohort is complete. So I'd like to pause here and mention now that also because of COVID-19, we have made the decision to run the 2021 program entirely virtual. There were many factors that went into making this decision, but ultimately we wanted to ensure that we are providing a safe learning environment to all participants and to ensure that during this time of uncertainty, we can be certain that we are providing the same experience to all fellows, regardless of where they live or ability to travel nationally or internationally. So we've been working diligently with our IT team and learning management company, along with faculty skilled at creating meaningful experiences virtually. And we're actually quite excited about the opportunity to provide a rich and meaningful learning experience, coupled with the ability to connect deeply with fellows, quality and safety leaders from around the globe. So let's talk about what that fellowship experience will look like. Just as this past year, fellows will bring new ways of thinking and innovative ideas for improving the quality of patient care, reducing harm, and improving quality of care and patient-centered outcomes back to their organization. Fellows will make a direct impact on their system while pursuing a strategic project with metrics tied to strategic organizational goals. They will deepen their knowledge in quality and safety science and learn how to lead system changes in quality, safety, and culture, including how to engage, influence, and impact culture change. Fellows will be exposed to quality and safety content. They'll have access to and guidance from renowned IHI leaders and faculty, including healthcare quality and safety experts, and innovative leaders who have improved systems in other industries. Fellows will also be exposed to leadership skills. A final presentation made to program peers, faculty, and project sponsor from the participant home organization, and interactive case studies and simulation-based learning opportunities. Fellows will also be exposed to support and networking opportunities. We'll create a lasting and meaningful global network of peers and faculty, allowing for an exchange of advice, ideas, and support in the long term. This includes an exclusive alumni network. In addition, senior sponsorship and active engagement from your home organization's executive team, including quarterly sponsor progress check-ins. And I want to pause just for a moment and really highlight the importance of identifying the appropriate senior sponsor from your organization. Can really build upon the fellow's experience, and it ensures that the project work that you're engaged in connects nicely to the work and overall strategy of your home organization. Fellows will also be exposed to mentoring, a dedicated mentor providing continuous feedback and support throughout your fellowship experience. I'll also pause here and make a point about mentoring. And this is something that we've seen with our previous fellowship program. Those mentor relationships, many of them have lasted over the years and careers of the individuals. So you're not just gaining a mentor for the year, but when the match is right, the lasting relationship over the course of your career is really phenomenal. Fellows can also expect access to key modules from the IHI Open School so they can refresh their knowledge of improvement science and patient safety principles and methods before starting their fellowship. Access to the CPPS online review course and credentialing exam, and Sarah will talk about that in a moment. 2 3- or 4-day virtual retreats. We'll talk about that in a moment, but February and June we'll have extended virtual retreats. We'll have bi-weekly live virtual meetings and bi-weekly self-paced online learning modules. Again, we'll talk more about that in future slides. Fellows can also expect independent learning assignments, and finally a final presentation made to program peers, faculty, and project sponsor from the participant's home organization. So I'm going to pause for a moment and invite Sarah to tell us a little bit more about CPPS.
Thanks, Allison, and hello, everyone. My name is Sarah Blossom, and I'm Director of the Certification Program here at IHI. And we wanted to highlight this as one of the benefits of the fellowship program. So CPPS stands for Certified Professional in Patient Safety, and through your fellowship program, you will have access to the online CPPS review course, as well as the opportunity to sit for this certification exam. And by way of background, CPPS was launched in 2012, and since that time, more than 3,000 professionals around the world have become certified. They include patient safety, quality, and risk professionals, nurses, pharmacists, physicians, healthcare executives, and more. And achieving certification requires passing an evidence-based exam that covers the 5 core patient safety domains that you see listed on this slide. And it's an achievement that attests to your patient safety competencies and expertise. And our goal is to give IHI fellows the opportunity to achieve this professional certification in safety as they continue to develop as global healthcare leaders. So if you are interested in learning more before beginning the fellowship program, you can do so by visiting the CPPS website at ihi.org/CPPS or emailing cpps@ihi.org. Back to you, Allison.
Thanks, Sarah. So I want to walk you through a typical learning month, but let me go ahead first and just show you the agenda that we've outlined. I realize it might be a little hard to see on the screen here, but you can actually download this on our website at ihi.org/fellowship. this really highlights each week that we'll be launching both live and virtual content. And so you can see the exact dates here. I mentioned earlier 3 or 4 days of live meetings in February and June. And I just want to call your attention. What we're trying to do is, as so many organizations are doing at the same time, really understand what's best for learners. And so we're exploring both 3-day of 4-hour calls or 4 days of 3-hour calls. And by the start of the program, we would definitely have that ironed out. But you can expect 3 or 4 days in February and in June. So let me go back and talk through what a typical learning month would look like. So again, we're talking about all virtual. So from the comfort of your home or office, you would expect 1 hour of fellow space and creating connections. So what is fellow space? This is a term that we started using this year with our fellows. It's an opportunity to get to know your fellows and create meaningful connections. And this is done both through quality and safety content and other curriculum-based learning and making connections. But also it's fun time as well. And it's meaningful ways to get to know each other, to get to know the work that you each are engaged in your home organizations, learning from one another. So it's structured time, but it's also, it's a little bit more led by you and co-designed by the fellows. Then there's 1 hour of live instructor-led learning. So this is strictly the curriculum-based learning time. 1 hour of independent learning. So as I showed on this slide, you can see that that there is the live learning and then the independent learning following the live learning. And then 1 hour of independent affinity group participation. And what we did this year and plan to do next year is to group fellows into affinity groups, and that's based on content or subject matter interest and also needs. So you would be given a survey prior to the start of the fellowship program and grouped into an affinity group. So let's talk a little bit more about the fellowship experience. And this is a graphic of pretty much everything that I've already described. But on the left-hand side, you can see that through support and networking opportunities and synchronous and asynchronous experiential learning opportunities, we'll be setting the foundation, developing relationships, and identifying challenges of leadership and project setup right off the bat in the fall and early winter. And as we transition into 2021 and early spring, we transition to sense-making and application, strengthening relationships, addressing the challenges of leadership, and project feedback. And then as we close out the year, we talk about future forward. Where do I go from here? Sustaining your leadership and project presentations. Again, in terms of curriculum, we'll be highlighting quality and safety content, leadership skills, and mentorship is also a key component of the program. So let's talk a little bit about the application, interview, and selection process. Some of you, I know from looking at the names on this list, have been interested in the fellowship program for some time, and so you've likely seen that that the dates have changed, and this was due to COVID, of course. And so we've now extended the deadline to Monday, August 17th at 5 p.m., and that's 5 p.m. Eastern time. Following that, we'll conduct a review of the applications, and some individuals will be contacted for phone and video interviews, and those will be conducted in late August, early September. And then admission decisions will be communicated to all applicants on or before September 25th. Tuition for this program is $22,000. And again, just a reminder, from this program, fellows will receive access to key modules from the IHI Open School, 2 4-day virtual retreats or 3-day virtual retreats, bi-weekly live virtual meetings, bi-weekly self-paced online learning modules, strategic project scoping and individualized mentoring, access to the fellowship learning community, affinity groups, and faculty, and access to the fellowship alumni community. I do want to point out that we do have scholarship opportunities. There is a limited number of partial need-based scholarships available, and you would apply for these scholarships at the same time you submit your application for the fellowship. So at this time, I think we'll open this up to all of you for any questions, and I will be here to answer them. And thank you so much for joining us today. You're welcome to chat your questions into the chat box. Don't forget, once you submit your question, hit send. You know, some people have hit enter and then it doesn't send. So you're welcome to chat or put yourself off mute.
Thanks, Allison. And just to let everyone know, if you want to ask a question, you can unmute yourself by going to that microphone symbol to the right of your name and just unclicking it so it turns white.
Thanks, Elena. So I see a question about sending the slides. Yes, we can send the slides to you. And also there's quite a bit of information on ihi.org/fellowship. So I encourage you to go there. We also have some testimonials from current fellows that are great to watch to get a sense of what they've gained from their fellowship experience. So great question coming in from Patricia. What criteria are you looking for in an applicant? So I think what, in terms of criteria, and I want to emphasize that the uniqueness of this program is that we have fellows coming from so many different regions of the world and roles and responsibilities in the organization. I recently spoke with an individual who is in healthcare, but she's also a patient advocate in terms of her work in quality improvement. And we certainly see a variety in terms of expertise in quality improvement. We have some folks coming in with quite a bit of expertise in patient safety and not so much in quality improvement, or vice versa. So I'm going to start by answering that question with the idea that we're looking at the individual as a whole. Now, with that, we are looking for individuals who are emerging leaders. Again, that depends on the individual and the organization that they're in. So not necessarily the role that you are in. So I want to emphasize that we're looking at you as an individual as a whole who's looking to advance your UI and safety leadership capability, and what does that mean for you in your organization. This next question is there a limit to the number of fellows accepted? And my response to that is there is not a limit to the number of fellows accepted. However, there is a review and interview process. What we're looking to do is to develop a cohort that, and I use actually a word that KDAR used last year, a mosaic of individuals who will create the fellowship experience. And so not all who apply are accepted. There is an application process, but there is no limit. We do not have a number in mind. So this question is this program focused on USA healthcare? I'm in Canada and looking for a program that would be applicable to other health systems. Yeah, so this is a global fellowship. So this year, actually, I think most of our fellows are from outside of the US. And we do have an individual this year from Canada. So I can say absolutely that it would be appropriate for you. This next question, it was mentioned that the fellows will have access to the CPPS content. Will the cost to get the certification be included in the tuition as well? Yes, both the review course and and Sarah, I'm going to ask you to come off mute and just clarify that.
Yeah, both the review course and the exam fee are included in the tuition. It's all built in.
Two barking dogs. I can relate to the two barking dogs. You're not working this time, so am I still eligible to apply is the next question. And also a great question that we get quite often. So my response to that, so we're definitely, we encourage individuals to work with their home organization and find a senior sponsor who will support them in this work. And I don't just mean financially, I mean support them in their growth as a leader within the organization and the project design and implementation. A huge component of that is ensuring that the project that you select is also aligned with the strategic direction of the organization. So working with a senior sponsor for that is really imperative. In terms of if you are not engaged with an organization, my recommendation would be that you identify an organization that you would partner with to implement your project. So inevitably, your project would impact a group of people or an organization, and so you would want to connect with them. So you might not be employed by them, but you would be working with the organization. In terms of the senior sponsor, then the next point would be, can you identify somebody in that organization that can support you in your growth experience? And I would be more than happy to talk with you offline. You're welcome to chat in my email, and you're welcome to reach out to me, and we can set up a time to talk at any point. Let's see if I can talk and type at the same time. So here's my email. Feel free to reach out. You can also email us at fellowship@ihi.org. What is the makeup with the class, so physician percentage, average age and experience? And I would say it's quite diverse, and this next class would not in any way be guaranteed to be similar to the next class. So we have physicians, nurses, quality experts, infectious disease, doctors, community health workers. So as I mentioned, it's really quite diverse. And then the next question, how many hours does the project work consume? Is it throughout the entire year? How is it assessed? Also great questions. So for the fellowship, we recommend that your organization commits to about 20% of your time, and that would include your fellowship time and also your project work. That said, it really depends on the significance of the project work in the organization. Is this a small side project, or is it really a major component of your work? So that's really the project itself is really up to you and your senior sponsor and your organization. In terms of the duration, again, it really depends on your organization and the project itself. I think that oftentimes folks come in thinking that their project is pretty straightforward and they start in the fall. So just speaking from experience from this past year, they come in the fall, they think they have it all figured out, and then after a couple of meetings together and talking and learning from our faculty and from one another, there's significant opportunity to improve the project. So I would suggest come into the program with an open mind about the duration of the program, but we do not, we also don't require that it is completed in full by the end of the year. In terms of how is it assessed, this is not a pass, fail, or graded program. There are expectations, there are mid-year project report outs, and then a final project report out, and ultimately you're really responsible to your organization that is supporting you. And it looks like Sarah chatted in the current fellowship class. Thanks, Sarah, for doing that. If you follow that link, you can take a look at our current fellowship class and their roles and what the regions that they come from. Any other questions from folks on the line? These were all really great questions. So I just want to say again, I chatted in my email address. Feel free to reach out at any time with any question. There's no question too small. I'm more than happy to set up time to talk with you. Some folks reach out to me to talk through project ideas, how to engage a senior sponsor, about funding questions. So please feel free to reach out to me at any point. I'd love to have a conversation to find out if the fellowship is right for you. Ryan's asking, how large is the fellowship cohort? So we have about 20 people in the class this year, and that does not mean that the next cohort would be exactly 20. As I mentioned before, we're really looking at the individuals that apply and thinking about how they all fit together and complement one another. So we do not have a set number, but regardless of the size, we would ensure that it's a meaningful opportunity for you to connect in deep and significant ways with one another. You're welcome. Any other questions? What do previous attendees say were the best parts of the program and feedback when completed? So that's a great question, and one that I can't answer fully because we have, as I mentioned earlier, we blended two very different programs to create this new design, which we're still now in the middle of. But I can tell you that, that the curriculum design and access to leaders in the field and what we really refer to as the IHI family, but the leaders at IHI, you would have direct access to them with our senior fellows and fellowship alumni. So the networking capabilities are very significant, but not just for networking, but really also for content delivery and their ability, you know, the fellowship's opportunity and the fellows' opportunity to be right there learning with some of the founders of quality improvement in healthcare. So you're interested in how they use their skills. So I think, you know, in the short term, they're using their skills for further development of their projects, but also future development of their projects. And we actually have a group of fellows who are designing an all-fellows project. So they're kind of coming together to do some work on the side that is beyond the scope of their organizational work. But you know, as they're advancing and becoming leaders themselves, they've come up with so many different ideas over the course of the year. Is there a social media group for these attendees? So the current attendees, we've been using Teams, and they themselves organize around a WhatsApp chat. However, this next year, we're implementing a learning management system where all content and discussions will land on a dedicated area on a website. And then we'll also have a community platform built into that. So there will be plenty of opportunity to interact and all housed within IHI. And I think just to emphasize that for the current class, what we've seen with the current class is they've become extremely close, and their learning extends beyond the curriculum and content that we provide. And you know, they're sharing their own work, and they're sharing work that they come across and knowledge that they come across now as they're becoming the experts. And so beyond, and I think that's where as you're asking about the social media group, and we'll be developing the community platform to fill that need, so much of that will take place there. And it extends beyond content, and really it's forming lifelong friendships where individuals have learned to lean on, rely on each other. And this is really emphasized during this time of COVID, when we brought the fellows together, not at an off scheduled time, really just to come together and talk and lean on one another. And the bonds that were formed over the course of the year were really apparent. For more specific list of topics and content covered, so we don't have the full curriculum listed. I'd be happy to talk with you if you are looking for more specifics, but other than slide 15, we don't have anything published on our website. Yeah, so please just reach out to me and we can set up a time to talk, Amanda. Any additional questions? Well, this has been a great discussion. Thank you all for the questions that you've raised. One more question. Have the residencies always been virtual or transitioned to virtual due to the pandemic? I mentioned the merger of the two organizations. IHI used to have an in-residency program where individuals, and it was a small number of individuals, were selected to move to Boston for the year and work in the IHI office. The National Patient Safety Foundation Fellowship was more similar to this model that we have with a larger cohort, and it included both virtual and in-person sessions. The redesign of the program and the program that was offered last year was that hybrid model. So we had both in-person and virtual monthly calls. This design for next year is entirely virtual and is due to the pandemic. Okay, I think I'll do last call for questions. Okay, well, once again, please feel free to email me at aperry@ihi.org, that's aperry@ihi.org, or visit our website at ihi.org/fellowship. And we look forward to future conversations with you. Please feel free to reach out to me. I can't emphasize that enough. I'd love to hear from you, love to hear what's important to you, and look forward to seeing all of you in all of your applications August 17th. Thanks so much.